I want to share with you a funny story. It's not really funny, but it can be if looked at with the right mindset. I had a doctor, a potential referral source. He's a primary care doctor. I did a marketing lunch at his office and told him about the therapies. And he called me a few minutes after I left his office. I will just say his name was Dr. Smith. That's not his real name, but we'll say he's Dr. Smith. So Dr. Smith calls me and he says, I want to thank you for coming in. And I said, okay, you're welcome. And he said, I'm going to send you some patients, but I'm in a special program with the health insurance companies where if I can save the insurance companies money, then they give me a bonus. When I send you patients, can you make sure that you don't give them anything that's expensive? And I paused for a moment and I said, sir, the cheapest thing out there is oxys and fentanyl. Do you want me to give your patient oxys and fentanyl when there's all these other better options out there that their insurance covers? And he said, no, I just thought maybe, you're from India and you might have something. I said, well, actually I'm from New York. But again, my parents were from India. You're hoping that maybe there's some magic herb somewhere in the Himalayas that solves pain that we Indians aren't telling you about. I don't understand. And I had this theory in my mind. Maybe I should go back to my home and take a weed from my backyard and send it to this guy and tell him that this is an herb from the Himalayas of India and he should drink it as a tea and that will give him a long life, just to mess with him. Because what a terrible, horrible person this guy is. He's taking the trust that a patient put in him for care and he's getting in bed with the insurance companies to purposely deny these patients good care that will help the patients because it costs the insurance companies more. And much worse, he is trying to make sure that if he does send them to anyone else to get care, that those people also only give his patients the cheapest care possible so he could get his bonus. And I thought to myself, how many people are out there that are doing that? With me, you're not going to get that. I'm not going to sell you on some snake oil that makes me a lot of money. But I'm also not going to deny you care and give you something dirt cheap because I'm in bed with an insurance company. I'm a believer in cutting-edge technology, emerging technology, data-based, evidence-backed technology. Anything that you come to me with, I will always go back to that evidence and I invite a discussion and a debate on that evidence. I won't peddle snake oil, but I'm definitely not going to go the route that this doctor did, which is let's get some extra money from the insurance company and let's give the patient the cheapest treatment possible. Folks, the cheapest treatment is oxys. Don't do that. That's not what's best for you. If the cheapest treatment is the best treatment, you should get the best treatment that's cheap. But if the cheapest treatment isn't the best treatment, then you should still get the best treatment. If you want to learn more about my clinic, please drop the word doctor in the comment section below.